Hello, my name is Mary Conti, and I'm the Director of Risk Management here at Palisades. Today we're going to discuss the appropriate process for patient identification to facilitate patient safety for all those patients that are in our care.
Proper identification begins the moment a patient enters our facility. The registrar will meet with the patient initially and will ask for their name and date of birth, as well as a legal picture ID to verify the information provided. The registrar makes copies of the identifications provided by the patient and uploads the information into our computer system. A picture of the patient is taken, which will be added to the electronic medical record and will also appear on the patient identification band. The information contained on all patient identification bands are name, date of birth, medical record number, account number, date of admission, and physician's name. Once all information has been uploaded into the hospital's software system, all documents, including the patient ID band and labels, will be printed by the registrar. It is important the registrar verifies the information accurately with the patient before fixing the identification band to the patient's wrist. All hospital team members are responsible to check the patient's identification band upon entering the room. If an event should ever occur where a patient's ID band is missing, at no time can any care or treatment go forward until the patient can be appropriately identified. The nurse must immediately notify the nursing station, and a call should be made directly to admitting. At which point an admitting representative will provide the patient with a replacement identification band. If the patient should be non-verbal, the identification process of name and medical record number must be verified by cross-referencing the ID band with the patient's electronic record. If any medication is being administered, the nurse must scan the medication as well as the patient's ID band to verify the name and MR number matches the electronic record. It is important to abide to the hospital's patient identification policy expected in your department. In the moment a patient enters the procedure room, the team member must introduce themselves, followed by asking the patient's name. Simultaneously, the team member must verify the patient's answers with the ID band and cross-reference the MR number with the intended procedure order. In the case of a child under the age of 4, the ID band will be placed on the child's ankle. The information on the ID band of a pediatric patient is obtained by the registrar in accordance to the information provided by the parent or the legal guardian of the child. It is the registrar's obligation to make sure it fits snugly as to not slip off. To reiterate, the process for patient identification at Palisades Medical Center is patient name and medical record number. In those departments where patients are being registered, the identifiers are name and date of birth. Once a patient is registered, the patient identification process becomes patient name and medical record number. Outpatients who check in departments such as physical therapy and wound care center, ID bands are not utilized. Verification of these patients are by presenting a legal ID with name and date of birth, and they are done at each visit prior to medical treatment.
In conclusion, you have seen that patient identification is one of the most important tasks that every one of us is responsible for before we provide any care or treatment to our patients. At no time, not utilizing the 2 identifiers for your department would ever be appropriate. Remember, every team member is responsible for making sure they are caring for the right patient for the right purpose. Remember, do you know who your patient is?